Great, I think we're live. So hello to everyone that's coming in and joining this panel. I'll just give a few minutes for people to come in. And as people are coming in, I'll just say that this is the panel on LGBTIQA+ community housing, a manifesto for action. Okay, great. So I'll make a start, as I think people will just be joining. So yeah, welcome everybody to this panel. My name's Jessica. I'm a Senior Policy Officer at Stonewall, and I'm going to be chairing the panel along with members of a community manifesto. So the Manifesto for London LGBTIQA+ community housing has been created by the London LGBTIQA+ Housing Community Coalition, which the acronym for is LLCHC. So we're made up of 7 organisations that are working on common issues facing the LGBT+ community across all age ranges. The 7 organisations that work together on this issue are Tonic, AKT, Micro Rainbow, Stonewall, Stonewall Housing, Consortium, and the Outside Project. So to give a bit of background as to why we're all here today, in January 2020, which seems like a lifetime ago, we were all working together on a manifesto for the next Mayor of London. Now, this was an LGBTIQA+ housing manifesto, and we've been working on a few months to look at the statistics on housing in London across the LGBT+ community and think about what recommendations we would like to put to the next Mayor of London. Our manifesto was almost finalised and ready to go out for the elections when the pandemic hit, and obviously, as you'll know, the mayoral elections were cancelled. So we reconvened a few months ago to pick off where we left off, and for the last few months we've been working together on a new manifesto that was launched yesterday. So to give a bit of context, I'll just give a few statistics which kind of give the context for why such a manifesto is needed. So in the capital, we have the highest proportion of people who openly identify as LGBT in the UK. In 2017, this was estimated to be about 5% of the London population, or about 450,000 citizens. In terms of LGBT+ people, nearly 20%, including 25% of trans people, and 28% of LGBT+ disabled people have experienced homelessness at some point in their lives, which is quite a shocking statistic. Young people identifying as LGBT+ also face disproportionate levels of homelessness at 24%. In terms of older LGBT+ Londoners, about a quarter of them have a disability or health issue that requires specific housing, yet 57% of them had no care or support provision, and 64% said their housing did not meet their needs. And when it comes to LGBTIQA+ specific community housing bed spaces in the capital, there are only 77, which is shocking when you consider that we've got hundreds of thousands of LGBT+ citizens. So considering the statistics and the data that we have, it's clear that London LGBT+ citizens need understanding and commitment when it comes to housing and homelessness, which is why we've put together this manifesto, which lists 7 key recommendations for the next prospective Mayor of London to commit to. And if the next Mayor of London were to commit to these recommendations, it would make a significant difference to the lives of the most disadvantaged LGBTIQA+ people in London. So in this panel, I'll be asking a set of questions to our panel that relate to these recommendations, and then I'll open the floor for 15 minutes to receive questions from attendees. So I'll start by just giving each panelist a space to introduce themselves and their organisation before we move on to the questions. I'll just go through in order of who I can see first on my screen. So Tina.
Hi, I'm Tina. I'm Director of Education and Engagement for Stonewall Housing. Stonewall Housing, at Stonewall Housing, we work to ensure LGBTIQA+ people live in safer homes, free from fear, and we offer housing advice and support for people of all ages, which includes supported housing for over 40 young people. We have a number of other services, including an advice helpline, national specialist training, and mental health advocacy, and we have an ambassadors and champion programme. And we've been around for 39 years this year.
Thanks, Tina. Joe?
Hi, I'm Jo. My pronouns are she, her. So I'm the campaigns, policy and research lead for AKT. So AKT is an LGBTQ plus youth homelessness charity. We work with young people between the ages of 16 to 25 who are currently experiencing homelessness or maybe facing homelessness or living in what we call hostile or abusive environments. We know that 77% of the young people that we support become homeless after being kicked out by their parents or caregivers after coming out. We provide a whole range of services, so our caseworkers do an incredible job at helping young people firstly find safe accommodation, mentoring, helping young people find employment, education, and stuff like that. Thank you.
Great, thanks, Joe. Carla?
Hiya, I'm Carla Ricola, use they, them pronouns. I'm the director of the Outside Project, and the Outside Project is crisis housing accommodation for the LGBTIQ plus community here in London. And we also run a community centre, so it's like crisis community accommodation and community space, so that there's an access point for people who are more marginalised within our community. So we were only set up a few years ago, but we're a really community-led project. We've really campaigned for as much space as possible. So now we've grown from being like kind of bucket shaking at a cabaret show to having 19 crisis beds for our community here in London, and operating the community centre as well in Central. So yeah, we've done a lot in such a small amount of time, and we're really proud to be a part of this group to try and push things forward even more.
Thanks, Carla. Anna?
Hi, I'm Anna Keir. I'm the Chief Executive of Tonic Housing. Tonic was set up to be a provider for older LGBT people. And we're looking to open the first provision in the UK of LGBT plus a retirement community in central London. This will actually be 19 apartments, but crucially, the scheme will have significant community space so that people can socialise, enjoy their later life, but there'll also be on-site care provision for those that need it, and we're working with another housing association on this project, and have actually been involved in training up all the care staff involved in that. So it's a complete sort of wraparound project to support the older members of our community. Tonic is completely community led. All our board members are members of the community, and we also have a community panel of people involved that have directly shaped and informed our work and our provision, and we'll be carrying this forward as we start to get new residents as well.
Thanks, Anna. And Maud?
Hi, I'm really excited to be on this panel. My name is Maud Goba. I'm the National Manager for Micro Rainbow. Micro Rainbow works in the UK to tackle the challenges of LGBTQI plus asylum seekers. We work mainly in three ways: in tackling homelessness and providing direct provision of safe housing. We opened the first safe houses that provide direct support for LGBTQI asylum seekers. We have accommodations in London, Birmingham and Leeds. We also now provide direct accommodation for those who are considered to have no recourse to public funds. And the second part of our work is mainly in tackling social inclusion, because LGBTQI asylum seekers are often excluded and suffer from extreme isolation. So we have a really big program in tackling that. We also have move on support, which is when people get granted asylum. When they're moving on, we work in supporting employability. We have employability support workshops, move on in terms of finding more permanent accommodation apart from apart from the employability side of things, as well as educational support for those who would have chosen to continue in education.
Thanks, Maud. That's great. So I'll get started with the questions. So the first question that we have is directed to Jo, but then as this is a discussion, obviously other panel members might want to come in. So Jo, there's currently very little data on the housing needs and outcomes for LGBTQIA plus people. How will recommendation number 5 in our manifesto help this problem?
So I think the recommendation would help immensely when we're talking about filling in the existing gap in terms of the data on housing needs and outcomes of LGBTQI plus people. So firstly, if we just take the recommendation to the GLA, which is requiring local authorities to monitor sexual orientation and gender identity in housing and homelessness services. So at the moment, as it currently stands, we have no accurate way of being able to determine how many LGBTQIA plus people are experiencing homelessness. And that's because the recording of this information is not mandatory. So what you'll find is that it's up to the discretion of local authorities. So some local authorities will record this information, some won't. And then just from a young person's perspective, so we know from research that only 35% were asked to provide info about their gender identity and sexual orientation. So it kind of begs sort of the question, you know, if we're not recording this data or this information, how are we to know about the housing needs of the community, or indeed, you know, outcomes as well? I think importantly as well, as the manifesto also recognises, there are actual barriers that do exist to disclosing this information as well for the community, and I think understandably so. So for instance, some members might not feel comfortable coming out to mainstream services. So from a young person's perspective, again, we know that just 1/3 of young people felt safe to disclose information about their gender identity and sexual orientation. So we would need to see the next Mayor of London working alongside with organisations like us to ensure that we're actually recording this information and that's uniform and it's implemented across you know, chain and also across LGBTQI networks as well. And I think then really we'll start to see more data coming in on the needs and outcomes of the community. And this is going to really help provide that kind of vehicle to then improve services, I think. And then also, you know, inform providers and commissioners. So I think from AKT's perspective as well, I think it's really the first step that we can start sort of seeing an improvement in terms of outcomes for the community. So that's why I think this recommendation is really important.
Definitely. Thanks, Jo. Did anyone else want to come in on that?
Just something quickly to say. I think with the way that data has been collected so far, I mean, we've had the LGBT survey. There was like 108,000 people that responded to that, and the government took no action on it. So that I can see. You know, there was a panel that was set up, and that's recently been disbanded, and we just seem stuck in this kind of like endless cycle of research, and that seems to be the work that the government does, is researching about us and then not taking any action. So I think that by implementing this into our manifesto, we can really take control of that and really change that cycle and try to break it going forward. Because that's, you know, I think the only way they tend to sort of give money and commission things is when they have all this data in front of them. It's very like capitalist structure, the way the system works. So we kind of need to be involved in it, and we need to inform it so that it works for us, because it hasn't so far.
Thanks, Carla. Anna?
I'd absolutely support that, both from Jo and Carla. Just to put in an example there that along with Stonewall Housing and Opening Doors, we did some research called our Building Safe Choices Research 2020. We actually did get some funding from the GLA to support that work because of the lack of data. and actually to take a community-led approach to gathering that data. And I think that was really borne out because we got responses from 624 older LGBT plus Londoners, so it was very London specific. So that's quite a high response rate, and that happened right in the middle of the kind of, we were halfway through it and the first lockdown set in. So a lot of our plans for doing outreach to people were limited, and we had to do it online, but it was very much that people trusted us as community-led organisations rather than them just filling in a form, say a government form, for example. So I think, you know, what we're putting forward in the manifesto is that it's really critical, if this data is going to be meaningful, that we need to have a role in that process.
Thanks, Anna. If anyone else has not got anything to say, I can move on to the next point. So the next question that I have is for Tina. And the question is, the need for LGBTIQA plus awareness training for housing commissioners and delivery staff has been highlighted in our manifesto. It's point number 4. How would you want to see this done?
I think when we talk, you know, we're a training provider, a housing training provider, and I think one of the things that's really important is that there's no kind of cohesive approach. So as it stands at the moment, it's up to individual organisations, individual boroughs to commission the training, and that means commitment from them. I think if we had a fully funded programme, then you're likely to get a lot more people kind of buying into that, a lot more people taking. The thing about funded training and commission training is often funded training is there's more take up on funded training rather than commission training. And there's lots of great training out there. You know, House Proud have what they call pledge scheme. We have something called the inclusion standard, which is a quality mark for organisations, but it requires that commitment. And I think if there was an input of actually that kind of funded training from the like as we've requested in the manifesto, I think it would make such a difference. At the moment, you know, we struggle to engage with a lot of organisations and particularly a lot of local authorities, and it can sometimes be that there's one particular person who thinks it's a great idea, and it's just not high on people's agenda when it comes to training. You know, our experience is that it's not high on their agenda, and we need to make it high on people's agenda, because it's about the service that our community is getting, you know, when they're presenting as homeless, when they're all sorts of, you know, frontline services, and commissioners as well. It's really important that we include commissioners in that, so that we're not, you know, we are visible, because we are invisible in that process. And I think that's where training addresses it. I think it's really important it's delivered by the community. I think, you know, that it has to be delivered by the community. And I think it would show commitment, you know, if it would show commitment. And it's also about best practice. It's about, you know, taking best practice that we learn from one borough, taking it to another. But it just needs, it feels to me, and you know, that there needs to be a cohesive approach. There needs to be kind of something that is recognised and is cohesive and funded, absolutely funded.
Definitely. Thanks, Tina. Does anyone else have anything to say on that?
Yeah, I think I agree. In terms of the training of frontline staff, most people who LGBTQI kind of turn around at when they arrive at services, and that is owing to the attitudes and ignorance of frontline staff. So it is completely essential and should be mandatory for frontline staff to be trained. Not only that, but to also recognize that, for example, the people that we work with are even marginalized within the LGBT community themselves. So how do you support people who you are not aware of their issues, or you're not aware of how to even address them? You know, we have trans people, non-binary people. When you arrive at a space and, you know, you're treated somehow, you're uncomfortable, then you turn around because you're not received. You won't access services. So it needs to be mandatory for frontline staff to be trained.
Yeah, I absolutely agree. Mandatory training is the way forward, and it's about commitment, isn't it? And it's about not remaining invisible, because we are invisible within services. And you know, the amount of people that I train who haven't even thought about some of the issues that we have. You know, thinking about, you know, trans people and in particular settings, and very often people will they just don't think there's an issue. And it's just so important that we highlight all of those issues, and that people know how to respond appropriately and use appropriate language and understand responsibilities under the Equality Act and all those, you know, all those things that training considers.
Definitely. Does anyone else have anything to add?
Yeah, I was just going to add as well, I guess mandatory training, because if people are opting in, it's kind of like they're already on our side. So the mandatory training is really for the people who don't want to know about us or don't want to support us necessarily, and just be like, this is what you need to know. And also, these are the organisations that you need to know about, so you can properly support people. Like when I find out that someone has been struggling with a housing officer or trying to go through the system on their own without being signposted to an advocate from one of our organisations, like, why has that happened? And it's because the housing officer doesn't know that we exist, and they should, you know. So I think that, you know, we need specialist support to kind of stand alongside us, you know. So people who are seeking asylum, you know, they need support from workers on Maud's team. You know, older people need support from Tonic, and younger people from AKT. So it's like, so that they're not stood alone, trying to educate those housing officers at the same time as trying to navigate the system that doesn't really seem to fit them. I think that from that side of things, that training it should be mandatory and it should be regular. It shouldn't be just like the moment someone starts a new job as part of like an induction and a tick box. It needs to be updated on a regular basis as our community grows and our needs change and our support services change as well. So we're constantly evolving because we're so small, like our sector, and yeah, we're still trying to build ourselves up in that sense, I think.
Thanks, Carla. It's a really important point. I'll move on to the next question, question number 3, which I'm going to direct at Carla, but as it's quite a broad one, I think other members of the panel probably want to come in and just discuss it quite widely. So question number 3 is, why is a London-wide housing and support pathway for LGBTIQA+ people so important to enable access to services? And 2, how does this directly impact on your work? So just for information, the third recommendation in our manifesto is to create a Greater London Authority portfolio role specifically for LGBTIQA+ housing.
Okay, so this question's really at the core of our work. It's about tackling the key barriers that people face in terms of accessing housing and related services. And this is why we've put forward that there actually needs to be a pathway for LGBTIQA people in London. We've got a unique situation in London of having 33 different local authority boroughs, and one of the key criteria in accessing affordable housing and homelessness services is all about your local connection criteria. And this is, you know, in effect, nothing short of discriminatory. It you know, does not at all recognise the issue of beacon cities, and that lots of people have actually come to the capital to flee the circumstances that they have had in their local area. And it very much links to the discussion we just had on training. You know, when people come into the frontline services, if they don't understand those issues, and the first question is, you know, how long have you lived in the borough? You know, people are just being denied access to those services and support from day one. So this is a really pivotal issue and part of our campaign. And what we're really calling for is to work with the mayor in terms of driving this forward, but it also involves all of the local authority boroughs. So, for example, working with the London Housing Directors Group to actually get the recognition of this discriminatory practices and how we can actually find appropriate pathways through. There are some precedents to this. So, for example, people fleeing domestic violence, not necessarily LGBTQI people fleeing domestic violence, but there are some routes. So we think we can build on those precedents and actually make a real difference for when people try to go through these processes. I'll just throw in an example in relation to older people and tonic, for example, and then I'll hand over to some of the other people on the panel to add to this. But from our perspective, we've got the added position of people actually needing assessments for care and support in their later age. So that has to be done on a local basis, and the funding of care and support is done individually by each London borough. So in effect, when Tonic are actually looking to provide retirement communities for older LGBT people, if people need affordable rented housing, then in effect, we would have to have one in every single borough to meet their needs, rather than actually boroughs joining collectively to address this, and people not always recognising that a local borough is their primary characteristic, but actually they want to be with other LGBT people and to create those communities, and it's just not economically feasible or appropriate to do that in every London borough. So there's just an example of some of the issues which people face, and actually it's not the same position. So for instance, in the private sector market, if you've got enough money to buy housing, you don't face these local connection barriers. So why should it be imposed on the people without money? It's just really unfair. I'm sure others would like to comment in terms of their experiences of this.
Joe?
Just from AKT's perspective, it's like such a huge issue, the issue of local connection for young people. And it's just a huge barrier to them getting housing and extra support as well. So I think it's the issue of if you've obviously had to leave, where you're from because your parents have kicked you out, for instance, and you do find yourself in a city like London, and then being part of a community as well, there's a lack of recognition of what the importance of that is. So around finding that community, if we have, experience familial abuse and rejection. So I think local connection is hugely important for the reasons that Anna was sort of saying, but also issues around young people not being classed as priority need as well, because sometimes there's a lack of recognition of the fact that, young people can also be victims of domestic abuse, specifically familial abuse as well, issues around young people being classed as making themselves intentionally homeless or being asked to provide evidence that they've been kicked out from their families. So this is why I think, there is a real need to have that really specific housing and support pathway for all of the community as well. But from AKT's perspective as well, it's a huge, huge issue for young people for a lot of the reasons that we kind of speak about in the manifesto and for the reasons that Anna said as well.
Thanks, Joe. Tina?
I would echo exactly what Joe said, and in terms of, for our advocacy service, every London borough, of which there's 33, they all do things very differently, but that thing around local connection is so difficult, and there is just not this understanding that people come to a beacon city for a reason. They might be fleeing family violence, or there's a reason why they come to a beacon city. And if the first time you go to a housing provider and they say, sorry, you don't have a local connection, we can't help you, where do you go from there? And if you don't know the support services that are there, you don't know you just don't know where to go. And I think lots of people slip through the net that way. And I think it just feels like there needs to be this cohesive approach, doesn't it? And it taps into all of the things that we're asking in our manifesto. Is about, let's find one way to do this. Let's find a London-wide pathway so that people recognise about beacon cities, they recognise about family violence, they recognise all those situations that people might be in, so that there isn't that, you go to the housing provider, they say, the housing authority, and they go, I'm really sorry, you don't have local connection. And then where do you go? I think it's really important that we have that conversation around how we create a London-wide pathway.
Carla?
Yeah, I'd just add, like, from the outside project's point of view, I think we're all working within the homelessness sector when we set up the project, and we'd all had experience of homelessness ourselves. So it's exactly what everyone said. Like, I would have, if I'd have approached a local authority, I would have been told I didn't have a local connection. If I'd have then gone to like any of the kind of voluntary or charitable like housing, they would have maybe considered me too high needs, because there's barriers to my housing. There's barriers. I had more barriers when I was younger. So the kind of voluntary and charitable, as much as we're doing ourselves as a community, there needs to be something that is, high support, properly funded pan-London system in place. I mean, a lot of the referrals that we get are from people who have, no recourse to public funds. They're drug, alcohol, mental health, and they come to the Outside Project in crisis. They're fleeing domestic abuse. Very clear cases of domestic abuse, but it's not being recognised because they're a gay man, or because they're bisexual, or there's something that unless you're a female survivor with a male perpetrator, it just seems like if you don't fit that narrative, then it doesn't count almost. It's like, I don't know, it's a very difficult system to try and navigate if you're anything other than what's written down in the book, that housing officers seem to run by. It's, it doesn't matter. We try and link people up. We have to link people up to solicitors. I'm writing to MPs. We're calling people out on Twitter. We're doing everything that we can to try and get visibility for our community in these kind of systems, through Star Refuge and through the crisis shelter. But it really needs to start coming from the state. They really need to start showing support. I mean, the Mayor's Office have really backed the Outside Project in the 4 years that we're running. We've been funded to open Star Refuge now, and we're really, obviously, really pleased that they're doing that. But it's really a start. Like, this is the crisis housing. We need like the whole pathway to be funded, because of just like this bottleneck. We're having to say no to 20 people for every one person we have in a bed. So it's really not enough.
Thanks, Carla. Did anyone else have anything to add on this point before I move on to the next question? No. Okay. So the next question is for Maud. Obviously, again, other people might want to share examples from their organisation, so I'll leave it open for everyone. So we use the term in our manifesto, nothing about us without us. Why is the community-led angle so important in all of this? And can anyone share an example from their own organisation?
Okay, I think with this question, as they say, if you're not on the table, you are on the menu. If you're not represented at the decision-making table in strategies and policies, you're really left in a vulnerable position. You get left out, and where's you're misrepresented, the vulnerable and marginalized are left behind. In this case, the LGBTQI plus community's needs are either partially addressed or not fully addressed at all. So no policy should really be decided by any representative without full or direct participation or engagement and feedback from members of the LGBTQI community. There are needs that are specific to our community that might be not considered or fully addressed in whatever strategy or policy that will be put in place. For example, you know, we've spoken about it, why LGBTQI people might not have ties in new areas, that they might be, you know, forgotten, or that they might not be viewed as victims of domestic violence, not considered for refuge when they should, you know, or why new refugees don't have ties in the area. For example, new refugees have 28 days, sometimes 21 days to leave home office accommodation when they're granted status. They're new to the country, they're still getting used to the welfare benefits, or they're signing up for them, and often they're told that the benefits they'll receive are usually 6 weeks, I think, after they apply, and they don't have any financial background. So it is easy for them to fall into homelessness. All these things can be easily bypassed if they're not known. And for example, in the past, trans refugees have been turned away from homelessness services and accommodations because they're not priority, and they're given sort of local night shelters to details to go to, but they experience abuse there and they fear going there. They are priorities. So if all this is not considered when these strategies and policies are being made, or these are things that people might not consider if they're not from the community, who is better to represent your needs than their person that you want to represent? So definitely we need to really stick by nothing about us without us.
Thanks, Maud. Does anyone else want to come in?
I just wanted to say I really like Maud's like the opening line of like, if you're not at the table, you're on the menu. It's so true. Like that's exactly how I feel sometimes. It's like someone with lived experience as well. I often get like I mean, I get emails, 20 emails a day asking for, you know, my story, or for the voice of people who are living in the shelter and things like that. And it's just kind of, I don't know, it's kind of gross. And you can tell that it's like, it's not being really led or designed, whatever the project is, for the group of people. It's more like that extractive. I don't know, there's something that's kind of like, we want to talk about you, to kind of validate whatever it is that we're doing. But we're not really, you know, we're only coming to you now at this point, rather than at the beginning of the conversation, because we need to have a case study of someone with lived experience, or something like that. And, you know, it's not the way to engage with our community. It's just not the way to treat anybody, really. So yeah, I second what Maud said, especially with people who are more vulnerable, people who are seeking asylum. You know, they've been through enough. You know, a lot of more marginalized people in our community have had huge barriers, and it's not easy for them to ask for help. So when they're faced with that kind of response from people that obviously have no connection to the community, or hadn't made no effort to really understand the kind of nuance of our needs, it can be really damaging for people to ever ask for help again. Not just damaging, it can be dangerous. I mean, people just go underground a little bit and end up in really terrible situations before they try and reach out again.
Thanks, Carla. Anna?
Hi, yeah, absolutely support this principle, and really eloquently explained by Maud in terms of what it means. I think some of the real issues here is that, you know, housing as you know, a sector, an industry, whatever you want to call it, has got some really fundamental problems. That it's something you do unto people. It's something that people don't have choice in. And that's, you know, that's not just in terms of how people access housing, it's also how housing is run, and, you know, whether, you know, residents actually have a voice in that. And so, you know, that's why, you know, in terms of the group that we've put together here, it's really important that we all are fundamentally community-led housing organisations, and that runs right through in terms of the access, but how we actually do things. So, you know, in taking that forward and making sure that, you know, residents are absolutely the heart of our work, and they, you know, they are actually leading the work as well. You know, we evolve and develop with that input from people, and that's really quite different from the mainstream systems. I was just at a meeting earlier looking at some of the mayoral pledges, and I was actually surprised to see that community-led housing was both in within the Labour manifesto, the Green manifesto, and also in the Conservative manifesto. I wasn't aware of that. So that is good that there's something to start this, to pin it on. But obviously our perspective is specifically how that is important in terms of LGBTIQA communities.
Thanks, Anna. Does anyone else want to comment to that one? I'll move on to the next question if not. So this is the last question, and then after this we'll take any questions from the audience. So this question is for everyone, so whoever wants to come in, go ahead. So one of our key recommendations is the creation of an LGBTQIA plus housing strategy for London. How would this directly impact the work of your organisations?
I can go first if you want. Yeah, so I think looking at our organisation being crisis accommodation, once people have got, you know, their stuff sorted, they've collected their evidence, they've made their homelessness application, and they're really just going through the system, then you know, there needs to be that kind of second stage and third stage of housing and places for them to go where they would feel safe and longer term, and they have like real structure and stability. So I think that's something that is so far really missing, is like that pathway out of crisis, out of homelessness. So people just kind of get stuck, and not just in our service, I know within the homelessness sector as a whole. So there needs to be, you know, as Tina said earlier, like real more cohesion and, you know, a clearer pathway. And as we've all said about local connection, it needs to be pan-London. It needs to be places that people feel safe to go to. There's no point someone coming to us when they're fleeing family abuse in, you know, Wandsworth, and then the local authority being like, well, this is your only option, you know. So it's kind of, they'll just say no to that, and then people just get stuck. So I think that having like a real understanding of who we are, what our community needs, we're really involved in the whole thing, and we've got a very clear strategy, really just something to build on. It's really a foundation that we don't have. And when you look at homelessness as a sector, I think the first homelessness shelter that was in London was like 200 years ago. You know, so this sector isn't new. But within our sector, Stonewall Housing are the oldest. You know, they're 35 years old. You know, they're the same age as me. So it's still quite young when you look at the wider sector. You know, we're still very much in the beginning. You know, so yeah, I think that this would be a foundation. It's really overdue. As I say, we've got a lot of support from the Mayor's office. Very happy. We've campaigned for 4 years for it. You know, but it's still, there's so much work to do. We're really, really at the beginning. So that's all I'd want to say about this strategy. I'm really excited that we're making a start together.
Thanks, Carla. Tina? Oh, sorry, yeah, go Tina and then Maud.
Sorry. And I would just echo what Carla said. It's you know, it's great that we've got this, but like Carla was saying, you know, we've been around for 38 years, I think now, Carla. We've been around for that amount of time, and we were set up as a response to homelessness. That's how we were set up, and it just feels like this, and I sound like a broken record when I talk about cohesion, but it is about having a strategy pan-London that, you know, everybody kind of knows what's happening, and the strategy that involves all those elements that we've talked about and all those things that we're asking about in our manifesto, because I think it just brings it all together, and it's just the beginning of it. it should have happened a long time ago, but this is just the beginning to make sure that the battle that we have every day to get our community housed changes, because that's what happens. We battle every day against a system that doesn't see us as being significant or visible sometimes in terms of housing. And I think this is a beginning, but it is just the beginning and needs to be built on, I think.
Maud, did you want to go?
Yes. I think for me it is quite exciting, and the impact would be really great for us, mostly because for LGBTQI migrants, they are often left behind. There are so many intersectional challenges for migrants, even within the LGBTQI community itself. They are vulnerable and at risk of a lot: homelessness, abuse, exploitation, even because of the uncertainty of immigration status, no recourse to public funds. There's lack of safety nets due to their migrant backgrounds. So they are fighting from all different angles because of their race, color, migrant status, sexuality or gender identity. So with all this, to know that there would be a strategy that will clearly include migrants and ensure that they're not left behind in services, especially because of the hidden homeless, and the fact that there will be support for example, LGBTQ women who again have hidden challenges. That would make a huge difference to our work. It's not only hidden refugee women, it's also trans people whose challenges are very unique and often not addressed. So when our clients obtain the refugee status, they are moving into a system from the home office into a mainstream world that is new to them. They are acclimatizing to a new country. It's really a time of great change. So a lot of our work is to support people through this period. So it would be great for us to know that there is a strategy in place, and we know exactly how migrants are not left out of this support, and to have a strategy that understands the specific needs of the LGBT community would be really invaluable.
Anna?
I'd just kind of like to add to that, really, in terms of the importance of the strategy is also about us being able to access the critical funding to do this work. You've heard about, the work that's being done is incredible, all on, very low levels of public investment, mostly through charitable support. And we're on the back foot of the kind of Section 28 years where, none of that public sector, investment was allowed for, our organisations. And therefore there's a significant catch up to be done, and that's why we've put the figure in terms of our strategy of our manifesto that that we counted up between us the number of beds spaces that we've got available as 77, and that in itself is incredible, but the need is far greater than that. So that having the strategy there is really about supporting what needs to be done with appropriate funding.
Thanks, Anna. I think I'll move on to questions now. So we've got 10 minutes. I'll take the first question, which is from Ben. Why do you think a lot of people don't see LGBTIQA plus specific housing as a priority? Why do they just see housing as housing?
Shall I go first? Sorry. I think when I speak to a lot of people about us and what the Outside Project do, they're like, oh, why is that needed? Can sometimes be like a bit hostile as well. as if we're trying to segregate ourselves off in some way. And I always say, like, we've made this space ourselves. Like, we're not taking space away from anyone else. You know, we've created this project and we've created this space. And I kind of have a joke and just be like, we're more fun to live with. We prefer to just live with each other. We're more fun to live with. But there is that kind of just like having a bit of banter, having someone who just gets your jokes, likes watching the films you want to watch, you know, just is part of queer culture. And you're not constantly having to like explain yourself or your movements or your trauma, you know. And I think that having safe space to live, you know, every community should feel like they have access to that. Like I say, I think queer culture is something that's developed over time in our community because of our oppression, and now it's very much become probably one of the only like stable housing solutions that we have is a lot of like sleeping on each other's sofas. I think we'll feel safer going to a bar and meeting a stranger and going home with them than going to the local council and being put in a housing project with a group of strangers. Do you see what I mean? It's just kind of, that's the options. You know, if particularly our young people, if they're given the option of like going on an app or calling the council, they're going to go on the app because they'll feel safer. We see it time and time again. But yeah, it's because of our oppression. It's because we have this like internalized, either through Section 28 or through our family oppression, we've internalized this, that, you know, we're only really safe around each other. And to be honest, that hasn't really changed enough. Like, it hasn't. We still experience hate crime in the street. So, you know, as Anna was saying about access to funds, I mean, I'm not calling for a tax strike anytime soon, but, you know, where's our healthcare? You know, where's our safety in the street? Where's our housing? You know, we don't feel safe in these kind of areas, and it's dramatically affecting our lives. So yeah, I think they really just need to look at statistics that are actually out there. You know, like read through the survey that they, you know, the 108,000 people that responded to the LGBT survey. There were some real clear, you know, examples of disparities in our access to these basic services. You know, they haven't acted on it yet. You know, but all that data is there, so they can look at that.
Thanks, Carla. Anna, and I'll go Anna and then Tina.
Yeah, that's a really helpful explanation, Carla, and completely echo that in terms of, you know, our work with older people. It's exactly the same. It's all about community. It's all about connection. It's all about, you know, not having to come out to someone every time you have a, you know, cup of coffee with them in a sheltered housing scheme, for example. The Building Safe Choices report that I mentioned earlier, we had responses that from 79% of people wanted either LGBT affirming or LGBT accredited retirement accommodation. Only 1% said that they would consider going into general accommodation. And there's, you know, some really harrowing stories of saying, you know, at that crisis point, you know, I would consider suicide rather than actually going into a general scheme. And, you know, I'm going to balance that with the, you know, the publicity that Tonic recently got when we announced our scheme, and our phones didn't stop ringing. And literally most of them just people, you know, elderly people feeling quite vulnerable and isolated, saying, finally, there's something for me. This is for me. I'm ringing, you know, how do I get, and it was just, you know, in a way it's quite, you know, heartbreaking, but also shows that, you know, this is what people actually want. We're just kind of actually trying to translate that into making a scheme happening, but it's very much the, you know, the demand comes from the community that they want housing and to be with other LGBT people in their later life.
Tina?
Yeah, I just would echo what Anna and Carla have said, and it's about, you know, why are our community not seen as a priority? Is because most people think housing is housing and therefore we should just have housing and we don't need anything extra, or you know, what is it that we need? And I think that's why there's a lot of intersectionality. There's a lot of, you know, years of oppression, Section 20. All those things come into play with housing. And the fact that people don't understand, it is sometimes about finding safe spaces, having a safe space. And I did some work with a focus group from the Outside Project, and there was somebody on that focus group who said to me, coming to the Outside Project felt like I took a breath for the first time. And I said, can you explain why? And they'd been street homeless for quite a long time. And they said, because I didn't have to explain anything. I didn't have to explain about my pronouns or who I was in a relationship with. I just felt for the first time like I took a breath. And I think it is that thing about how our services respond to our community, but we're not seen as a priority because we aren't seen to have any, we don't need any extra, you know, why do you need extra things? You're just creating ghettos. You know, it's that kind of comment I hear all the time when I'm doing training. And I think it's just, people just think you know, it's totally safe for us to be in. Housing is housing, you know, why should it be something different, I think.
Thanks, Tina. Joe or Maud, did either you have your hand up there, or?
Yeah, just sort of on what Tina was sort of saying, I think it's quite frustrating. There's often like this naive view that because we have stuff like the Equality Act now, that suddenly, you know, everything is all fine for the community, and, you know, we've already made such like strides. And I think it's just around sort of looking at the stuff that Carla was saying around, you know, if you actually were to have a look at any research that is out there, that there are multiple levels of just discrimination that the community face, whether it's in housing, healthcare, and other like facets of life as well. So I think we need to kind of move away from this idea that, you know, equality has sort of been achieved and that's sort of it, which is, you know, something that at AKT we kind of have to kind of challenge each time.
Thank you. Maud, did you have something to add?
Yes, I just wanted to agree with everyone and say that, you know, housing would be great if we didn't have, you know, discrimination, if we had safe spaces, and if we were fully included. But there is need for this specific support because we still have issues. So it would be great, but at the moment it's not ideal. There are still issues to address, and in the face of discrimination, exclusion, and people not feeling safe, people do tend to try and find spaces where they feel safe with their own community or create those spaces for themselves. So until we have such a time when we are included in the wider strategies, or there is no discrimination and we don't face all these challenges, then, you know, we still have to fight on and try and find those safe spaces and provide those, address those needs.
Sorry, I was muted. I'll take the next question, which I think is, the system needs to fit the person, not the person fitting the system. How are your organisations able to challenge the housing system, and what can we do to help? Anna?
Shall I just jump in there quickly? I'm just going to give the example of some feedback we actually had from the Greater London Authority following the publicity Tonic got for the funding announcement for our first scheme. And they said that the publicity coverage of it was one of the largest they had ever seen for a policy initiative. I thought it was quite ironic because it wasn't the GLA's policy initiative, it was ours, and we had to fight for nearly 2 years to get that funding. But it does show you there in terms of the you know, what we can do, and what, you know, this is a really good example of us collectively coming together and showing how much our organisations have got in common, what we can do in common, and how we can campaign for the changes that we need to see.
Thank you, Anna. So we've got 2 other questions that hopefully we can fit in. We have 1 minute left, but I think we can go over by a few minutes. So the next question is, Anna Keir made an interesting point about each borough providing LGBTIQA plus housing themselves. Is there any data on which boroughs might have a greater or lesser need for it?
Do you want me to answer that one slightly? There's no data as such in terms of the different housing needs, as Joe explained earlier. There is data in terms of the different levels of populations. So, for example, Lambeth has the highest LGBT population in London, but also in the UK, interestingly, greater than Brighton. But, you know, all the statistics are a little bit out of date now, so we might see some of that changing with the new census if people actually answered those questions. But yeah, fundamentally, no, it's not looked at in that way. And I think I was highlighting that question as, you know, it doesn't have to be borough by borough. What we need is actually London to be working collectively and the boroughs to be working together to provide appropriate housing rather than one in every borough.
Thank you, Anna. So we've just got 1 more question to finish on. That's a really good question. Any advice for homeless LGBTQ plus people trying to access housing and stay safe right now?
Can I go first? I'm going to say the obvious, aren't I? Contact Stonewall Housing. And you can do referrals on you can do a self-referral, or you can phone our advice line. And I mean, yeah, that's kind of, I would do that organisationally, but that's what we do. That's what we do. I don't know that's, I don't know if they're looking for more practical advice, but well, I suppose it is practical, but yeah, that's what I would do.
I would say stay seen, try and stay away from apps, people that you don't know. Be honest about your situation to people that you do know. Reach out to the community as much as you can. But yeah, the main thing is like being seen and letting people know what's going on for you, because it's not easy out there, especially if you're sofa surfing. I say if you're sofa surfing, you are technically homeless, so you have access to the COVID vaccination. Tell your GP that you're homeless, even if you don't feel like you are, because you're staying at a friend's and the next friend and the next friend. So COVID safety, I do that. And as Tina said, reach out to the helplines. AKT has a helpline, Gallup does, Stonewall Housing does. You can do referrals online. You know, so just get an advocate to stand by your side if you're going to try and access the housing, like the housing system, because you're gonna need it even in this pandemic.
Thanks, Carla and Tina. I think that's really useful advice. Did anyone else have anything to add quickly? Maud?
I think I would just hi. I think I would just like to add that even if you're a migrant and you're not sure if you're eligible to anything, do reach out to the organizations that Carla spoke about, and Stonewall Housing and Micro Rainbow. There is always support, and you know, we will talk through it and find ways to help. So don't just think or guess that, you know, no one is going to help me because I'm a migrant, and continue in exploitative situations. Just reach out and try and find support.
Thanks, Maud. Great. I think that's, if no one has anything else to say, we've just managed to fit into time. We're only a few minutes over, and we've answered all the questions that we were asked. So yeah, thank you everybody that's been watching and watch this space. Hopefully the next Mayor of London will take on all of our recommendations.